You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. He is a board-certified prosthodontist from ClearChoice Dental Implant Centers. We've had him on the program before, Dr. Terry Kelly. Dr. Kelly, welcome back to the program.
Thanks, Randy. Good to be back.
Now, for people that don't know ClearChoice, who's the typical implant patient you see?
Well, actually, Randy, we have patients that are in their 20s. We have patients in their 90s. You know, most of our patients have the same expectations regardless of their age. So for our patients at ClearChoice and the patients I see, they really want to have, you know, a nice, healthy, beautiful smile. So that can be appropriate for any age. Well, we have really two categories of patients that we see.
Okay.
We have patients that have a lot of dental issues, bleeding gums, teeth are painful, infection, they don't work well, they may have some missing teeth. So those are people that have really been challenged with maintaining the teeth they have.
Like they feel like they're headed to dentures.
Yeah.
And so they don't want dentures, and that's why they
so
go to you possibly?
They're looking for a solution because nobody really thinks about having something that comes in and out of their mouth. So our other group of patients are already in dentures.
Okay.
So they've gone through what I call their dental tour of duty, whatever it was, and it was an option for them, and really there's no nothing natural about having a denture. It's an option, it's a solution, but it's not something we would choose if we knew kind of the rules of engagement with the denture.
Now, you say you'd like to see more denture wearers, but it's challenging. What do you mean by that, to get them in?
Well, that's a good question. So when we talk about our patients in dentures, you know, they're kind of out of the dental loop. They don't really have regular dental visits anymore. They've solved a problem.
Okay.
But for them, you know, they've adapted somewhat to wearing the denture, so they don't go in for regular dental visits. If they do, it's not a happy experience. They're having their denture adjusted again or relined. So they really don't have that same information that maybe other patients
So they don't even know their options.
Yeah, they're not aware that there is an option.
Now, where you are there a lot of people that, like in Florida, I mean, are there a lot of people that are either headed to dentures or wearing dentures? Because I think of Florida as being such a healthy place.
Well, you know, if you took the people that are in dentures, headed to dentures, those in partial dentures already, you could fill up, you know, we're a great sports town in Tampa, Raymond James Stadium, you could fill it up twice over. So there's a lot of people that really need the treatment, but a lot of people really don't have the information that there is a better solution.
Okay, now, I interviewed you about 3 years ago.
Yeah.
What's changed?
Okay.
Because you say a lot has changed.
There have been a lot of changes. Gray hair, so more of it. But, you know, for us, technology has really helped us. So now we're able to really get very precise about what we do and how we do it. The other thing that's changed is, you know, I was here with 6 months of my ClearChoice experience and my patients. We're almost 4.5 years into it. So now I've learned from my patients. So I understand really what their challenges are and how much change we can actually make for one person.
Yeah, we were talking in the green room and you were saying your appreciation for how much this actually impacts their life is big.
Well, it is, because, you know, you and I have great teeth, so we take it for granted. You know, if you and I want to go out to lunch today, we can do that. We don't think about what we're going to eat.
Good point.
For my patients, they have, you know, a preconceived set of rules they operate by, because, you know, if they're going out and they're not able to predict what the menu is, they may decide, I'm not going to go. It's not worth it. It could be uncomfortable. If I'm wearing a denture, I may have to take it out while I'm eating, or I may have to excuse myself, go to the bathroom. It's never really convenient for them to do this. So that's one of the things that I've learned from my patients. You know, they're very good at camouflaging what's going on. And a lot of times, you know, even close family members don't know the severity of what's happening because they don't really smile much, so you can't see where the issues really are.
So how old can you be to do this? Like, what's your oldest patient that you've given brand new teeth to?
Well, so our oldest patient was 95.
95?
Yeah.
Why would a 95-year-old want to do this?
Well, that's a good question. So, you know, just to kind of understand, you know, everybody, regardless of what age in life they are, has the same expectations to be able to eat and chew comfortably. You know, especially when we get older and maybe we're not in our careers, our social life revolves a lot about, you know, eating and going out with friends, family, or maybe church groups, seeing our grandkids, but food's always a part of it. So being able to do something where you really feel like, yeah, I'm the same way I was 40 years ago. You know, they had those same expectations.
Now, a lot of, we talked because I interviewed you before.
Yeah.
And you say people will watch the show with you like several times. And then they still come in and they still are a little bit skeptical.
Right.
Elaborate on that.
Well, I actually had one lady, a very sweet lady that came in, and she said, you know, Dr. Kelly, I watch you every night before I go to bed, which is a little frightening because, you know, I don't expect people to really, you know, focus on maybe the same thing over and over again. But for her, it was really personal because she was skeptical. But the more she looked at this, she thought maybe that's a solution. So she came in for a consultation. She was wearing dentures. The one thing she did mention, though, is that I really didn't like the host. I didn't like the way he was asking you questions. So I thought I'd pass that along.
I was
to you.
interrupting you too much, probably. So
Yeah.
I'll try to give you a break today. Sorry about that. So you say you see transformations every day. I mean, because you do this pretty much every day.
Yeah. So our patients, you know, come in with challenges where you'll be able to see the changes dramatically, and they are dramatic changes. I have a lot of stories we'll go through.
Let's start there.
All right. So, you know, we talked a little bit about our denture wearers. So, my friend Art here is not wearing dentures. Now, Art's had 2 sets of dentures. He was a crane operator, heavy equipment.
That's his smile?
That's his smile.
Okay.
You know, he's a well-adjusted guy, but he wants to eat and chew, and dentures aren't working. So he's not wearing anything. So for Art, he really wants to eat and chew. You know, he can't do anything as it is now, and wearing nothing obviously isn't an option. So for him, dramatically, he now has teeth that stay in place. So he can go back to eating comfortably and very simple, you know, requirements. So for him, he really didn't want to have, you know, anything that was a highlight for his smile, but he really wanted to be able to enjoy food and just enjoy his retirement. He worked hard all his life, so that's a great result. And you can see, I think, if you look in his eyes and just his facial expression, you know, he feels satisfied, he's happy.
And they could eat like whatever chewy things. We talked about pizza on the last show. I mean, so they could eat nuts, salads.
Yes. There's no limitations.
No restrictions, like whatever you could eat with your regular teeth?
Yeah, this is really built to let people enjoy whatever diet they think is healthy for them or their favorite foods. There's no limitations.
So no way a guy like that's going to wear a denture?
No.
Did they go in there and say, Doc, I just want teeth that don't come in and out?
Yeah, and I think that's the real difficult part for patients to understand. Nobody really knows about a denture unless someone else has had it. And I had a lady who grew up in the Bronx, and she said, you know, I had a lot of my friends and family and my neighbors that ended up having dentures, but I never saw them wearing them, and I couldn't figure that out. She goes, now I know, because I got my dentures and I can't wear them. They're too uncomfortable. They move around when I eat, and I completely understand now why people weren't wearing them, because they just don't work.
Wow. So a guy like this, back to this guy, is it true? So on the day of the procedure, they can literally walk in with no teeth and walk out the same day with upper and lower teeth that don't come out.
Yeah, and that's really the...
Is that common or very unusual?
No, that's common. You know, our patients come in with the expectation that we're going to build something that's long-lasting, permanent set of fixed teeth, and that's what we do. So at the end of the day, we call it the reveal. It's a big time of celebration, really, because this is the first time a lot of people have seen the smile they would have liked to have had. And the bonus for that is, you know, their family gets to share it with them. So our whole staff gathers around, their family members. We give them the mirror, and they get to see themselves for the first time, and it's pretty dramatic.
Wow, do they ever get choked up? They look at the mirror?
They do. And the staff does, too. Even though we do this every day, you know, it's new for them, and it's still new for us. When we see something come to life, you know, that we've designed, I mean, that makes us feel proud, and we're as happy for them as they are for themselves. Okay, so this next patient, this is pretty special. So I'm going to pass along Paul's photo. So Paul is our lab manager. Paul's been with ClearChoice since 2008. Very experienced, very talented guy. Paul, as you can see in his smile, doesn't really have a full smile. He's learned to camouflage his teeth. He's building people's teeth every day, designing their teeth, and yet for himself, he's managing a partial. And when a tooth fails, he adds another tooth to it. When he comes and gets me earlier in the morning, he says, I need you to take out another tooth.
Wow.
So we're in this together. So for Paul, I said, look, I think you're ready, and I know I'm ready because this isn't a good relationship we're having. So the option for Paul was continuing down the road he's on, failing teeth, painful teeth, headed to a denture. And obviously that's not going to happen, in our center.
Not working at ClearChoice,
no,
right?
that's not an option. So, for Paul, he wants the same things that all my other patients do. So here's his after. And you can see,
Very nice.
Kind of a very nice natural smile. He built it himself. I tried to give him guidance. He had it all covered. So, but it makes a huge difference, and that's somebody who does it every day. So you can see that even for them, it's a fantastic transformation.
Well, they look natural,
yeah,
right? And I'm not trying to side with you, but they look very natural.
Well, that's our goal. 80% of my patients want something that's a natural, I call it a modern, healthy version of them. I have some patients who want to turn up the volume, big, vibrant, bold smile. That's okay. That's something that you can choose.
So they take part in what their teeth are going to look like?
Absolutely, yeah. We have one appointment before surgery we call the smile design. So really, we bring Paul in, we do all of our kind of resourcing, we look at different shades, shapes. We pick something that's natural, and we can also change things based on what patients like. I'd love to show you some pictures of our patients that have had some characteristics that we kept in their natural teeth.
Okay. And so with him, he can eat whatever he wants. So what
Absolutely.
is he like? The way it looks or what he can eat?
Well, Paul, Paul's definitely a gourmet cook, connoisseur. So he likes to grill, he likes to barbecue, he likes to eat. So the smile is great, but I think having teeth that feel comfortable and he can chew whatever he wants, I think that's the big benefit for him.
So he's a big believer. Is he your only patient that made their own teeth? Because he
so
works
far,
there?
yeah.
So far.
Absolutely.
All right. I know you wanted to show me this next photo. What are we looking at?
Yeah. So, we were talking earlier about the ages of patients. So, my friend Jeremy, came to us, and he really was battling, as you can see, teeth and having comfortable teeth, limited to a soft diet. He had a dry mouth. Dry mouth tends to lend to things we can't control sometimes.
Okay,
teeth
so that's what
deteriorate.
happens when I look at something. Wow.
Yeah, and he's got a great smile, but nobody's going to be comfortable and confident with teeth that look like they haven't been taken care of. And to his credit, he came in, sought out a solution, and it was really a turning point. The biggest reason he wanted to do this was, one, get out of pain, but right next to it, he's a new father. So he was setting a good example for his son, and he really felt like this was important for him to do.
And so his option would have been a denture as well, possibly.
Yeah, because there's no saving teeth, especially when they're painful. One of the biggest things that we always consider is, getting rid of infection, taking care of the pain component so that, you can have some comfort. So in one afternoon, Randy, we were able to take him from a point where he couldn't manage his teeth any longer to having a fixed set of teeth that look good, that don't move around.
Is that him over there?
Yeah. It's a huge trend. This is one of those big, vibrant, bold smiles, and I think you can see that. So, that's the transformation that we see every day. And for our patients, when they have a solid set of teeth on implants that build something that they can be proud of, it does change their life.
We were talking in the green room earlier about that a smile is more attractive than a pout.
Yeah.
And he is more handsome because of his teeth.
Yeah. And I think he knows now that he's got something that really gives him a sense of completeness. He feels like now he's going to be that father that he wants to be. So if you look at the before and afters, look how much detail we put into the design of the teeth. So
on the after, yeah.
Yeah, absolutely. There's some changes in how we align the teeth. There's a little bit of rotation. We do that to break up the light, because if you don't do that, everything looks very uniform. And
so
that's not how
rotation
teeth
meaning
are.
some of the teeth are a little bit off on purpose.
Absolutely, and it reflects light differently. So you can do that, and because our technology now allows us to put this into a digital platform, we can play around with that and get something that we really feel like is going to be custom and complement, what a great smile he has.
This guy's got to be thrilled.
Yeah, he's very happy.
Okay, we're going to take a quick break. We come back, more about the process, what people can expect on day one at ClearChoice. You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. We'll be right back. You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. My first guest, he says nobody should be wearing a loose-fitting denture. We've had him on the program before. He represents ClearChoice Dental Implant Centers. Dr. Kelly. Dr. Kelly, welcome back. Lots of good photos. Now, at ClearChoice,
Yes.
I guess it's unique in many ways, but one of them is, I guess, how implant dentistry is normally done. You go to one doctor that does the surgery, another place for the imaging, like the x-rays or CT, and then another doctor puts the teeth on top, and sometimes they go somewhere else to get the cleaning, and then it's sent out to a lab. But you're at ClearChoice, you do it all right there.
Yeah, and that's one of the big advantages of being in a center that's designed to kind of have every aspect of implant dentistry under one roof. So for us, the technology, having a 3D scan and image to work from, so that gives us a chance to really look through what's available as far as bone, because we have a lot of patients that have been told they don't have enough bone. So right from the very beginning, we're able to really bring that to our treatment planning, which is very important.
Now the thing though about bone, isn't it true, if you've been wearing a denture like 10 years, is it true you don't have enough bone to do this?
Well, that's not true, Randy, because actually the great thing is with the technology that we have, many people do have bones. So we're able to do exactly what they'd like to have. And that gives us a chance to take somebody who's, kind of adapted to the shortcomings of a denture and build them a complete set of teeth that really makes them feel like I'm back to where I was.
Well, good for you. Now, look, we've had this program for 21 years. I've had other doctors on the show. Everybody knows ClearChoice.
Right.
Everybody wants to ask me, what are they? I mean, they're big fans of yours. It's like, and they say, well, it's like the dream practice to have the oral surgeon, the prosthodontist, the lab, everything right there. Is that one of the reasons why you're able to do it faster?
Yes. Well, having everything in one center allows us to really build everything that we want without the miscommunication that can happen when, like you said, the patient's, going to the surgeon, then the dentist for perhaps the restorative part, and then maybe it's sent out to a lab, it comes back somewhere else. So there's a lot of areas where things can, go awry. So this gives us a chance to really use everybody's talents. And as I mentioned before, Paul, my lab manager, is very talented. So he's our design specialist. And we get the most out of, having the two specialties that really work together well in implant dentistry. Let me show you this next patient.
All right.
So this is another really visible transformation. So when you look and see really kind of the chronology of dentistry here, you can see he's had some dental work for sure.
All right.
But the smile is not nearly what we would all like to have. And, his story revolves around, he's in front of people, he's a manager.
Okay.
Does a lot of work with his colleagues in front of customer service people too. And he just felt like not only is he in a situation where he can't really taste food, but he's also, kind of shrinking his personality. So he's starting to become very self-conscious. So this gives us an opportunity to really kind of go back to where he can feel comfortable and confident.
So those teeth also could not be saved. Like he would have probably had a denture.
Yeah, when you look at kind of a tooth as it goes through its lifespan, there's a time stamp. When you start having a filling, turns into a crown. If you're lucky, you have a bridge, maybe not, maybe a partial denture. At some point, there aren't enough good teeth to really complete the set that works for you. So for him, giving him a chance to really feel like, hey, I've now got a long-term solution. I feel great. I can move on. No longer a soft diet. I can.
That's him over there?
Yeah.
He shaved the beard?
Now,
that's amazing, actually.
Before I give you this, so this is the day of surgery.
Okay.
So that's our surgical set of teeth.
Wow.
You wouldn't know those two are the same person.
Yeah.
And I think that's really what keeps us focused, because we know the results we can achieve, and it's great for our patients when they see that. Yeah.
Now, is it like 50-50 men, women, more women than men that are doing this?
I would say it's probably equal.
Okay.
Women tend to be a little bit more proactive about taking care of themselves.
We like to put it off, the guys.
Yeah, we're
in so much pain, we finally do it.
We'll kick the can down the road until finally there's no other option. So I would say they're about the same. I see probably more younger men, because I think at some point, they've maybe changed their lives in some respects. So some people need to change, kind of their outlook, and changing their teeth and looking at themselves differently really puts them in a different path.
How soon can they eat? So you've done the procedure, they get their teeth in that one day.
Well, they can eat that evening. Okay. So we do restrict the diet. We call it a pasta or less diet. But yes, you can eat that evening. And let's remember, some of these patients have dealt with pain to the extent where they're really limited their diet anyway. And they're very uncomfortable. They have infections. So when you take out the broken teeth and the infected teeth, that pain quotient kind of goes away. So they're able to eat comfortably the day of surgery.
And before you know it, you can eat whatever you want.
Yeah.
Do they ever call the office and say, are you guys sure that I could eat a steak?
No, but I can tell you the number one food that's on everybody's list they've circled when they get their final set of teeth is steak.
Is that right?
That's number one.
They want to eat the steak.
Yeah.
And salads. I guess if you're wearing a denture, it's tough to eat a lot of things.
Yeah, it's really difficult, especially for my patients that are wearing a denture or have removable partial dentures. If they're trying to manage a healthier diet, I have a lot of patients in my practice that are diabetic. So, you know, soft foods are easy to eat, but they're not great to help manage their disease. So it's kind of a catch-22. So for them, there is a health component.
So if you have type 2 diabetes and it's controlled, you can get this done.
Absolutely.
Okay, good. Time for a few more.
All right,
I'll
great.
try to rush you because we're short on time.
Okay, this is great. So now this is a patient of mine who really had a couple things happening. He was in a motorcycle accident.
Okay.
So we lost some teeth as a result of that.
Okay.
But also he has, you know, a bite discrepancy. So his teeth, you know, from early on never fit together the way they should. So we're able to make a big transformation. These are the cases we love to do because we know the result ahead of time. So for him,
So it's like an underbite.
Yeah.
And he didn't like the underbite.
Well, it's with so few teeth and the position of the jaws and the underbite, it was difficult for him to chew. So he really wanted to be able to enjoy the things you and I do.
And as a prosthodontist, like this is right up your alley?
Yeah, exactly.
To do this kind of stuff?
Yeah.
Okay.
And his neighbor barbecues a lot. He couldn't really enjoy it, so that's on his list. So now this is the 10-day post-op.
Wow.
So I like to show that to see
I
what
think
can happen in 10
anybody's seeing this
days.
side by side. This is pretty.
And the biggest thing you'll notice
dramatic.
is the change in the way the teeth fit together. So this puts him back into what we would consider a normal bite. So for some patients, it's the first time in their life they've actually had that. So that's one of our favorite cases.
That's great.
Okay, so we haven't talked a lot about, you know, the females that are in our practice as well. So really same wish list. You know, this is another one of our patients who, you know, had a long-standing history of being very self-conscious about her bite. You know, she had what she called and described as buck teeth. So, you know, this had been something that had affected her entire life. So she moved to Florida, taking care of her mother, and this was on her wish list. So, and again, another dramatic, you know, transformation where we changed the bite. And this is her result. So you can see the, you know, the improvement and kind of a light in her face. You know, I think she realizes now she's finally kind of achieved that goal and has something that she's
everything we're
proud
talking about, these are not removable teeth. That means these are upper and lower fixed teeth that don't come out.
Right. There's no limitations. They work like our natural teeth do, and it's a long-lasting, permanent solution.
So she had buck teeth most of her life.
Yes.
And in one day it's gone.
Yeah. So you can imagine if you put yourself in that position, that's a pretty dramatic transformation.
Story.
Yeah.
Good for you.
So I know we're a little pressed for time, but
time for two more.
Okay, good. So this is my friend Chief. Everybody in Tampa Bay knows him as a color analyst for the Tampa Bay Lightning. So he came to me one day and he said, "Hey, look, you know, I'm having some struggles now, and I can't really camouflage this on air." And as you look at it, his front teeth are just—he's a hockey player, so they've had their fair share of wear and tear. So, you know, that's where he is now, and we made a big change for him. So now this is the first time he's actually had a full set of teeth in some time. Can you imagine, as a hockey player, those things tend to change over your lifespan, especially playing.
You know, you know what I'm picking up on as I look at all that, it really does change the appearance. It makes them look younger a little bit too. I mean, it's very nice.
Yeah, it changes, I think, how they feel about themselves, and also, obviously, their ability to kind of do what they want to do, his career.
Okay.
This is a fantastic story. So this is an after picture, and so this is a great transformation. You'll notice how natural looking. This is the final set of teeth. And
so you left the gap there?
We left the gap, and that was one of his criteria. Absolutely keep the gap.
Oh, good.
You know, he served his country in Vietnam. had a family. His wife unfortunately passed away after 40 years of marriage. So his daughters pushed him to get treatment. They said, you've got to get back out there. He's a very healthy, good-looking guy, but did not want to wear a denture anymore, and it was time to move forward. So he was a challenging case. We had to use all of our technology to find bone. We did, and there's the result. And
looking good.
Looking good, and he's found someone special.
Nice.
Yeah.
Good story.
So great result for him. So, and I think we have time for one more.
Yeah. Okay. We'll watch this. It's very nice.
This is my friend Sharon. Now, I knew her before she became a patient. She's the face of a golf course resort community. I play golf there occasionally. She's at the front, the first person you see. So she's still in front of the public. Her teeth, she had managed her entire life, done everything she could to keep them. If you notice closely, she's wearing a retainer we made to keep her bridges in place because they're falling apart.
Okay.
So, until we could get to our surgery. So she's a very well put together lady, but here we have her with her final set of teeth.
Wow.
Yeah. So
now you walk in the golf club, she's there, smiling bigger than ever.
Right. So I'll look forward to seeing her there.
And she can eat whatever she wants.
Absolutely, yeah.
We're out of time. Final message. Those two groups of patients, the people headed to dentures, really bad teeth, or they're currently wearing dentures, which you said you'd love to see more of. But let's say they've heard what you had to say, but they're still skeptical, or they're still putting it off.
Yeah, well, come in and see us, because we have a chance to really change the game for you. Sharon gave me a message. I saw her this week. She said, you know, Sharon, I'm going to show your story, but tell me a little bit more about why you waited so long. She goes, you know what? I just didn't feel like I was worth it. And her husband's standing there and he goes, you're absolutely worth it. And I said, do you have any regrets? She goes, no. My regret is I waited too long. I should have done this 10 years ago. So I would give that message out to everyone. Don't wait, because you have an option to change things now.
It's a free consultation.
Absolutely, yeah.
And you'll give them a treatment plan that day.
You'll have a treatment plan that day, yeah.
Okay, good. So somebody watching this, no teeth. If everything works out, they could have their teeth in a month from today.
Yeah,
easily.
absolutely.
Next month, brand new teeth.
Yeah, brand new teeth, no more dentures.
All right. I want to thank you so much for coming on the program.
Yeah, thank you, Randy. Great to be back. Yeah.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.